I want to spend just a few minutes talking about a technology that is becoming increasingly popular for analyzing exercise, both primarily in the lab, but increasingly out in the field or in clinics, and that is electromyography, or EMG. It's actually the same technology that's used if you have ever been to a hospital and had an electrocardiogram, which is like the wires that they hook up to your chest to visualize the electrical impulses going on in your heartbeat. That's called a electrocardiogram, ECG, sometimes the German acronym EKG. Same technology. What it's doing is it's measuring the electrical potential, like the electrical voltage, that's generated by the neural impulses that get sent from your brain through your nervous system into your muscles. And so that happens via electrodes. So in this picture here, this is bicep muscle. Probably this is what biceps brachialis maybe. These electrodes are positioned for. So this negative and this positive electrode are measuring the electrical signal that is being sent through the nervous system to that muscle in particular. Now, if you think back to our ideas about excitation and activation, we talked about the process by which a neural excitation signal, an electrical signal, gets translated into muscle force production, which we called activation. And this had to do with the release of calcium from the sarcoplasmic reticulum, and it diffuses into the muscle fibers, et cetera, et cetera. What's important to remember is that EMG is going to be a measure of muscle excitation, which in some situations is not going to be exactly the same thing as muscle activation. And if you recall, those situations are when you're doing a really high velocity explosive exercise. You have circumstances where maybe if the excitation signal goes like this, the muscle activation, the muscle force production, will lag behind a little bit because of these excitation-activation dynamics. But, and there's a question on problem set 3 about this, if you're doing a motion that's relatively slow or a motion that's isometric, we can say these are essentially the same thing, and the difference is not that important. Because if you're moving very slowly, these short-term millisecond level differences between muscle excitation and muscle activation are pretty much irrelevant. Now, EMG is useful because it can tell us how the body is activating different muscles when it's doing an exercise. Now, EMG is not exactly the same thing as muscle force. Even some people kind of say, oh, well, EMG, it's telling you how much force the muscle's producing. But we got to keep in mind that the muscle force production is a function not only of its activation level, but also of its length and its velocity. Because you could be activating your muscle at 100% activation, but have a relatively low force production if the muscle fibers are really short or if the velocity that the fibers are moving at is really fast. So I would say EMG is roughly equal to excitation, which in some circumstances, slow-ish movements, we can say is about the same thing as activation. Or it's like the percent of the current max force we could produce? Question mark. And the current max force, I don't mean the maximum isometric force. I mean whatever 100% muscle activation would produce, which is again a function of both muscle length and muscle velocity. So EMG looks kind of like this, and you got to do some signal processing stuff to get it looking nice and smooth, and you have to usually you normalize it to 100% of this MVC, that stands for maximum voluntary contraction. So if you do an EMG study, you'll have somebody say, flex their bicep as hard as they can against resistance. And you do that a few times, and you record whatever excitation or whatever electrical signal that is in millivolts as 100%. And then you can measure everything relative to that 100% level. This is an important thing to do because people with different subcutaneous fat levels, or if they're sweating or not sweating, That's going to affect the absolute amount of electrical potential you measure, like the amount of voltage that you measure. So the idea of normalizing everything to this maximum voluntary contraction helps with that. It also gets you this nice percentage that you can express as a percentage of what we might say is roughly the maximum muscle activation. So EMG studies look something like this, where you would have EMG electrodes on the various muscles that you care about, and you could look at the activation patterns of those muscles at specific times in, say, a lift. Now, this whole like full setup with motion capture and many EMG electrodes is generally restricted to research settings, but more and more you're seeing EMG used in physical therapy clinics and rehabilitation centers for a type of therapy that's called biofeedback. And that works like this. You could imagine, say you had a patient who'd had a stroke, and you're trying to teach them to relearn how to use their arm. You might connect some EMG electrodes to a muscle that was maybe partially paralyzed or inhibited, or it's not really the muscle that gets paralyzed or inhibited, it's your brain's ability to activate the muscle. But say you have a patient who's having trouble flexing their wrist. Maybe you put an EMG sensor on their wrist flexors or wherever those muscles that you care about are, and then you just have them look at the screen and try to generate a signal and associate the building new activation patterns with seeing the electrical signal on the screen. So biofeedback is maybe the big new area where you might see EMG in the clinic. Another cool application you can use EMG for is understanding how muscle activation patterns differ between athletes of different skill levels. So this is and maybe I want to focus on, let's ignore this part for now. I'm going to focus on the muscle excitation strategies between trained cyclists and novice cyclists. So this, I think, is tibialis anterior, tibialis posterior, some of the other, probably peroneus longus, gastroclateral, and the soleus. So these are lower leg muscles. And this is time on the x-axis here. The thing to notice is that the trained cyclists don't activate antagonist muscles at inopportune times. So notice here. These muscles are almost entirely silent. So in the cycling in the pedal, the pedal cycle, when you're going down, you want to be activating your calf muscles, correct? So here, for example, the soleus, you activate your soleus on the way down, and then you don't want them to be contracting when you're going back up like this, because that would counteract the direction of the pedaling. And you'll notice that's what good cyclists do, whereas less experienced cyclists, they have this co-contraction, we would call it. So they have this, they're activating their muscles in an inhibitory way. So you could compare, say, this with this. Notice how there's a lot of unproductive muscle activation right here. That might be directly related to the difference in performance between these two groups. So EMG is a pretty cool technology, and you will see it, I think, used here and there. You might bump into it even in clinical settings through this biofeedback approach. So it's good to know the basics of it. There's a lot more complicated stuff you can do with it, but I think knowing primarily that it is roughly a measure of muscle excitation, and that in situations that are not super high velocity or super explosive, you can say the excitation is about the same thing as the activation. So you can think of an EMG signal, once it's normalized to this MVC, as telling you what percentage of full muscle activation you are activating your muscles at.